Hello, and thank you again for taking the time to watch today's clinical presentation. On this case, I'm going to replace 3 old PFMs with BruxZir anterior crowns, explain my reasons for the material selection, show you how I achieved gingival harmony between centrals, and then I will talk about my criteria in choosing the impression tray. These PFM crowns have been in place for a couple of years, and as the gingival recession took place around number 8, the low value around the margin can be noted. We can also note the gingival inflammation, especially around number 9. On number 7, open margin was also visible on the X-ray. There is also a gingival disharmony I will try to correct with laser. I start by evaluating the gingival tissue thickness in the simplest way using a metal periodontal probe into the sulcus. Because we know recession of periodontal tissue is more common with PFMs, and this risk increases in patients with thin biotype, this technique will help me assess the gingival biotype. It can be noted that this patient has a thick gingival biotype. I begin cutting off the crowns by making a vertical opening with a tapered zir cut burr and extend this opening across the incisal edge. I will also go over the lingual since these crowns have a very thick lingual metal colors. I want to make sure I separate the metal all the way to the gingival margin, and great care should be taken not to nick the gingiva. There was no difficulty in cutting these crowns off. I could see clearly the cement interface, so no risk of damaging the tooth, but we can inadvertently damage the gingiva. You can use a retraction instrument and get the tissue out of the way, but I didn't here, and you will see I slightly nicked the gingiva on facial of number 9. But in this case, I knew I need to do a focus laser recontouring to bring the gingival architecture of number 9 in harmony with number 8. Crowns came off pretty easy when I used the Christensen crown remover to expand the vertical opening. We can see there was some stain on number 7 where there was an open margin, but the preps have a fair amount of tooth structure left and there is no decay. Because dentin color of these preps were not dark, I selected BruxZir Anterior for the final restoration. This material can be milled down to 0.9 mm thickness, and I am able to do less preparation when teeth are not discolored. In the end, with this case, we hope the restoration will have an increased translucency that allows the light to pass through, so we get papilla and gingival margin that are nice and pink, unlike with metal-based restoration. Another reason for selecting a material like BruxZir Anterior is that CAD/CAM offers superior margin fit. Also, I have the ability of cementation like with any other PFM, but without the risk of metal margin showing up if in the future the patient experiences recessions again. I am packing now Ultra Pack 00 cord from Ultradent. I usually do this to provide a vertical gingival retraction of 0.5 mm and then drop the margin to the new gingival level. We can see these margins are already more subgingival than I would like them to be, and you can clearly see how I nicked the gingiva on number 9. Because there was a lot of bleeding, I am using here the Picasso laser to do a sulcular debridement and remove the inflamed tissue on number 9. I had the laser set on basic at 0.8 continuous wave for 20 seconds, making sure I am short of the pocket depth. I use a diamond burr from Axis Dental to smooth the margin. Then I use the laser to bevel the gingiva. Note how the nicked tissue went away. I'm not going to impress at this time. We will temporize and let the tissue heal for about 2 weeks. Biotemp CAD were used to improve patient smile during this healing phase. The potential of Biotemp CAD is that if the patient likes them, they can act as a template for the final restoration. For more tips on this step and how to seat your biotemps in 15 minutes, check out my assistant episode on Chairside Life. Note how the gingival embrasure were open to avoid impinging on the papilla and allow room for patient to floss. Here is after the tissue has healed with the biotemps in place for 2 weeks. At this time, the biotemps were removed and the margin preps were finalized. After packing the BruxZir cord, there is not much to be done other than rounding sharp angles or incisal edges and providing a smooth margin with a fine diamond burr. For this case, I use 2 Ultra Pack cord from Ultradent as my second cord to provide horizontal retraction. To keep the cord in place dry and provide pressure on the tissue, I use anatomical comper caps. I like anatomical comper caps because they are pre-cut for mesial and distal areas to avoid pressing too much on the papilla and allow the cotton to reach the facial and palatal margins. We keep them in place for about 7 minutes before removing the cord to take the final impression. We use here a triple tray from Clinician Choice. My criteria for using this tray is for times when I want to impress no more than 1 to 3 units per quad, such in this case. I like it because it is rigid and it has a thin web, not plastic mesh like other trays, and it locks in the occlusal registration without interfering with patient closing comfortably. After I guided the patient into centric close position, my assistant makes sure patient stays there during the full setting time. If the patient has failed to close all the way, but the impression of the working and opposing sides are satisfactory, we can still use the impression if a separate occlusal registration is taken. When that happens, then we instruct the technician to mount the models with the registered bite. It is important for a product such as BruxZir Anterior to take a picture of the prep with the stamp shade in place and send it to the lab. In this case, since I felt like the underlining preparation would not change the outcome of the final color of the restoration, I only took the shade of the surrounding dentition. When we want to change the shade of the final restoration, if prep is, for example, slightly darker, then it is important to have a picture with the stamp shade as well. If the prep is too dark, or if there is a metal post, then BruxZir Anterior will not be indicated, as the translucency of this material will pick up on the dark underlining structure. This is at the final delivery appointment. After the temporaries were removed and preps were cleaned, we note that tissue has healed beautifully. We proceed with the cementation of BruxZir Anterior crowns using Ceramir cement from Doxa Dental. Because the color of these preps were on natural dentin and because BruxZir Anterior comes in all 16 Vita shades, we see how these BruxZir crowns were able to blend in nice with the surrounding dentition. Pre-op, we noted how the health of the soft tissue affected 8 and 9 appearances, predetermining a slight change in gingival architecture of number 9, especially in high smile line patient like in this case. We can see post-cementation how the trend of the soft tissue is characterized by an ideal symmetry. There is a correct parallelism of the gingival line and the incisal edge position. After removing the excess cement, I'll check the occlusion and phonetics to make sure there will be no interferences. I'll check for F sound and confirm the incisal edge is in ideal position, and there is no lisp when I check for S sound. When we look at the gingiva post-cementation, we can see we increase the aesthetic result at the same time maintaining adequate biologic integration of the new restorations. Because BruxZir Anterior is a more translucent zirconia, it allows the light to pass through, so we get papilla and gingival margin that are nice and pink like you will get with all ceramic materials. Patient was very impressed with the result and she would like to change other old PFMs and get more work done to restore the posterior area. Stay tuned for a future episode. Thanks again for watching.